Getting answers about prostate cancer. Kurt Ludlow is in the On Your Side Help Center tonight with doctors and nurses from OhioHealth. Kurt?
Well, if you were watching yesterday, then you heard me make a very personal announcement that I recently found out that I have been diagnosed with prostate cancer. Thankfully, stage 1 prostate cancer, the very early stages, found by a blood test that you're going to find out a little bit more about a little bit later. But since the diagnosis, I have come to know a lot about prostate cancer. In fact, it will affect 1 in every 6 men in the U.S. We have put together a phone panel here that will answer any questions you have about it. 614-481-6848. They'll be here until 6:30 tonight. September is Prostate Cancer Awareness Month, and it's interesting because it comes at the same time that I was recently diagnosed with prostate cancer. Thankfully, it's stage 1, but it was diagnosed after a very controversial blood test. I'm going to show you that in just a second, but a warning first, you're going to see a graphic that contains the male anatomy.
Hi, Tim.
Tim Duffy is getting his blood tested for prostate cancer, a PSA test, prostate-specific antigen, a protein produced by cells of the prostate gland.
I work in an office where I see a lot of cancer, and the PSA is one of the indicators. That's an early detection, so it's a good opportunity for me to have that test done to see where I stand.
Before the PSA test, there was only one way to find prostate cancer.
In the old days, it was found by doing a digital rectal exam. Digital, some people think that means computer, but no, digital meaning your finger, the digit.
Been there, done that. But prostate cancer can't always be felt by a doctor until it's too late.
And in those days, when we operated on a patient after we found cancer, we had a 50-50 chance of curing them of the cancer. But since PSA's come along, we are now able to cure over 90% of the men. So it's dramatically changed our ability to find prostate cancer. We find it much earlier than we did before.
Dr. Burgers recommends that men start being tested at age 50.
I sharpened it just for you.
Age 40 for African Americans or men with a family history of prostate cancer. But opponents, including the U.S. Preventive Services Task Force, think the test harms men who wouldn't die from the disease by subjecting them to side effects from surgery, radiation, and other therapies. Thank you.
You're welcome.
I mean, without you, we wouldn't be doing the stories, and I wouldn't be getting the surgery that I need. William Grauman is my primary doctor, a believer in the PSA. He ordered the test that found my cancer early and likely saved my life.
If we don't treat your prostate cancer, you're still going to be alive at 13 years, but your prostate cancer will unlikely be curable at that point. And metastatic prostate cancer is very painful. It's a very gross way to die. We can do something about it right now, and I prefer to do that.
26,000 men died from prostate cancer in the U.S. last year, down from 48,000 in 1991. What is the message we want to send to men and to women who have men in their lives about prostate cancer and the importance of early detection?
I think what we want to say is, if you're going to get a cancer, prostate cancer is not a bad cancer to get if you catch it early. Because if you catch it early, we have treatments that can cure the cancer and still have a very high quality of life afterwards.
Now, those treatments can range from surgery to chemotherapy to even radiation. I'll be having surgery on Monday at Riverside. Dr. John Burgers is my surgeon. Looking forward to that appointment with you on Monday. You've been gracious enough to take a lot of phone calls tonight. Yeah. What's the most common question you're getting?
You know, we've been getting lots of good calls, but the most common is symptoms.
And what are they?
Yeah, and that's unfortunate. There really aren't a lot of symptoms until the cancer spreads, and that's why this PSA is so important. Because if you wait till you have symptoms, it's too late. So the symptoms usually are when the cancer spreads to your bones. You start having severe bone pain.
And that's the thing about mine, is that I didn't have any symptoms, and the digital rectal test didn't find it, and the PSA did, and so we're thankful for that. All right, get a good night's sleep on Sunday night, will you?
I will.
All right,
thanks.
Thank you. There you go. So if you want to ask these physicians and other medical folks any questions about prostate cancer, give us a call. They'll be here until 6:30.